Hi, my name is Michelle Menner. This is my daughter Shane, who will be posing as our 38-year-old victim, police officer who sustained multiple injuries after a work-related accident. Go ahead and lie down. As you can see, I'm already ready with my gait belt around her leg to perform distraction with physiological abduction. I plan to provide grade 4 joint mobilizations. Just stay still. And so here we go. Grade 1, barely moving. Grade 2, larger amplitude, no resistance. Grade 3, into resistance with larger amplitude. And then grade 4, small resistance, large amplitude, or small amplitude, I'm sorry. Into resistance, small amplitude. Okay, the next one I'm going to do is I'm going to continue to use my gait belt, and I'm going to do a posterior glide to increase hip internal rotation. I'm again going to do a joint 4 grade mobilization. And just relax your leg, Shane, as I place this underneath your leg to support the weight and on top of my shoulder. And then I'm going to go ahead and do a grade 1, grade 2, no resistance yet, grade 3, large amplitude into resistance, and then a grade 4, small amplitude into resistance, past resistance. I'm going to have you move a little bit closer to me. Let's go ahead and have you lie on your side for our last hip joint mobilization, which is going to be an anterior glide to increase hip extension. I'm going to place a pillow between her knees and make sure that she's resting comfortably. And I'm going to stabilize at her hip as I push anteriorly with the palm of my hand. So grade 1, just thinking about it. Grade 2, into a larger amplitude, no resistance. Grade 3, larger amplitude into resistance. And then a grade 4, large amplitude, past resistance. And then we'll move on to her knee, and I'm going to have her go back onto her back, just relax, and I'm going to do a posterior glide of the tibia on the femur to increase knee flexion. She's in the supine position with her foot flat on the ground on the table, and my hands are around her tibia. My fingers are behind, and my thumbs are anterior. And I'm just going to assess range. What's a 1, 2, 3, and we're going to stay at a 3. So large amplitude into resistance. Right. And then I'm going to do an inferior glide of her patellofemoral joint to increase patellar knee mobility. Just relax your legs, no muscle building right now. And I'm going to place the web of my hand on the superior border of her patella and reinforce with my other hand as I perform inferior glides. So a 1, just thinking about it. A 2, a larger amplitude, no resistance. 3, larger amplitude into resistance, or to resistance, and that's where I'm going to stay. You always want to move into, when doing patellar moves, you want to go into the area of resistance. So the third one is going to be a medial glide of the patella at the patellofemoral joint. And again, it's to increase patellar mobility. So my hands are along the border of her patella, and I am going to use my thumbs to push medially into the resistance because she was tight medially. So 1, I'm thinking about it. 2, greater amplitude, no resistance. A 3 is greater amplitude, 2 resistance, and I'm going to stay there. Alright, and then we're going to move on to the ankle. And I'm going to start with a joint traction of the talocrural joint for general mobility and to decrease ankle pain. So you're just going to relax as I place my fingers on the dorsum of her foot and my thumbs on the plantar surface of her foot, and I'm going to distract. And since it's the most painful joint that she has, we're going to do grades 1 and grades 2 for pain management. Just relax. Try and relax. So 1 is thinking about it, and then a 2. Larger amplitude, no resistance. And then I'm going to place a towel roll underneath her leg, and I'm going to have you slide back just a little bit. I'm going to provide some stability and stabilize at her lower leg as I place my hand on the talus just under the mortise of her ankle joint. And I'm going to push posteriorly, and this is to increase dorsiflexion. And I'm going to do grade 1. So I'm just thinking about it, barely moving. And my patient has a case of the giggles, so go ahead and lay onto your belly. And we're going to do grade 1 joint mobilizations for an anterior glide at the talocrural joint. And I'm going to this is used to increase plantar flexion, and in her case, it's also to help control pain. And I'm going to place my hand over the calcaneus, and the mobilizing force is anterior. And it's a grade 1 joint mobilization, so I'm just thinking about it. My production crew has come up with a case of the giggles. All right, and then the last joint mobilization is going to be a medial glide of the subtalar joint to increase ankle eversion. And so I'm going to go ahead and get my hands ready. I have my one hand on the calcaneus, and I'm going to glide medially. And I'm just going to do grade 2 joint mobilizations. So there's a 1, thinking about it, and then a grade 2 is into larger amplitude without resistance. All right, thank you very much.